Hi friends, welcome back to Smile Nursing tutorial. Let us discuss about allergies. First, what is allergies? A damaging immune response by the body to a substance, a particular food, dust to which it has become hypersensitive. Next, coming to the types of allergies. See, we can see the number of allergies in that: food allergy, skin allergy, dust allergy, insect sting allergy, pet allergies, eye allergy, drug allergies, allergic rhinitis, latex allergy, mold allergy. Next, cockroach allergy. Coming to the signs and symptoms, the release of histamine can cause a variety of symptoms, including a skin rash, headache, sneezing, runny nose, swelling, nausea, and diarrhea. The most severe reaction, known as anaphylaxis, can be life threatening. If the allergen is breathed in, the reaction will most likely affect the eyes, nose, and lungs. If any allergen is consumed, then it affects the mouth, stomach, and intestines. Next, coming to the diagnosis. How to diagnose this allergies is skin prick testing, skin testing on arm, skin testing on back, patch testing. Next, blood testing. Coming to the management. In this management, we will have two types. One is drug therapy and second is immunotherapy. In drug therapy, it includes antihistamines, glucocorticosteroids, epinephrine, mast cell stabilizers, and anti-leukotriene agents are common treatment of allergic disease. Next, anticholinergics, decongestants are also commonly used. Next, second, coming to the immunotherapy, anti-allergy immunotherapy. This is useful for environmental allergies, allergies to insect bites, and asthma. Its benefit for food allergies is unclear. Immunotherapy involves exposing people to large and larger amounts of allergen in an effort to change the immune system's response. Next, coming to the nursing management. It is also very important. In this nursing management, first of all, we have to assess the patient condition, symptoms, and severity. We have to advise the patient to keep medications with her and also advise patient to take only prescribed medications and encourage to avoid contact to allergic food, dust, pets, etc. And also advise the patient to contact a doctor if there is any severe symptoms like swelling of face, lips, eyes,